Welcome to my YouTube channel. Today's topic is hypertension, that is also called high blood pressure. The current definition of hypertension is systolic blood pressure values of 130 mm of mercury or more and diastolic blood pressure more than 80 mm of mercury. Persistent blood pressure reading of 149 by 90 mm of mercury or more should undergo treatment with the usual therapeutic target of 130 by 80 mm of mercury or less. This is hypertension. Stages of hypertension. Normal stage of blood pressure shows the reading of systolic blood pressure is between the 90 to 129 mm of mercury and diastolic blood pressure shows the reading between the 60 to 79 mm of mercury. Stage 1 hypertension shows the reading of systolic blood pressure is between 130 to 139 mm of mercury and diastolic blood pressure is between 80 to 89 mm of mercury. In stage 2 hypertension, the systolic blood pressure is between 140 to 179 mm of mercury and diastolic blood pressure is between the 90 to 109 mm of mercury. In critical stage of hypertension, the systolic blood pressure over the 180 mm of mercury and diastolic blood pressure is over the 110 mm of mercury. These are the stages of hypertension. Salient facts. Hypertension is a serious medical condition that significantly increases the risk of heart, brain, kidney, and other diseases. An estimated 1.13 billion people worldwide have hypertension, most two-thirds living in low and middle income countries. In 2015, 1 in 4 men and 1 in 5 women had hypertension. Fewer than 1 in 5 people with hypertension have the problem under control. Hypertension accounts for more than 9.3 billion deaths per year, suppressing tobacco with around 8 million deaths per year. One of the global targets for non-communicable diseases is to reduce the prevalence of hypertension by 25% by 2025. Baseline shows 2010. Etiology. Most cases of hypertension are idiopathic, which is also known as essential hypertension. It has long been suggested that an increase in salt intake increases the risk of developing hypertension. One of the described factors for the development of essential hypertension is the patient's genetic ability to respond to salt. Salt sensitivity is a measure of how blood pressure responds to salt intake. People are either salt sensitive or salt resistant. Those who are sensitive to salt are more likely to have high blood pressure than those who are resistant to salt. Poor sleep quality or sleep apnea, excess alcohol intake, and medical stress could also cause hypertension. This is the etiology of hypertension. Risk factors. Risk factors are divided into two categories: modified risk factors, non-modified risk factors. Modified risk factors: unhealthy diet, example given excessive salt consumption, a diet high in saturated fat and trans fats, low intake of fruits and vegetables, physical inactivity, consumption of tobacco and alcohol, being overweight or obese. Non-modified risk factors include a family history of hypertension, age over 65 years, coexisting disease, example given diabetes or kidney disease. Sign and symptoms. Hypertension is called a silent killer. Most people with hypertension are unaware of the problem because it may have no warning signs or symptoms. When symptoms do occur, they include early morning headaches, nosebleed, irregular heart rhythm, vision changes, buzzing in the ear. Severe hypertension can cause fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. An evaluation of blood pressure by a health professional is important for assessment of risk and associated conditions. Pathophysiology. There are various mechanisms described for the development of hypertension, which include increased salt absorption resulting in volume expansion and impaired response to the renin-angiotensin aldosterone system, increased activation of the sympathetic nervous system. These changes lead to the development of increased total peripheral resistance and increased afterload, which in turn leads to the development of hypertension. Measurement and diagnosis. Identifying patient with abnormal blood pressure and accurately diagnosing hypertension is extremely important for both healthcare provider and patients. Measure blood pressure when client is relaxed and sitting. A sphygmomanometer is used to measure blood pressure and an inflatable pressure cuff around the upper arm. Blood pressure is recorded as two numbers. Example given 120/80. The larger number indicates the pressure in the arteries as the heart pumps out blood during each beat. That is called systolic blood pressure. The lower number indicates the pressure as the heart relaxes before the next beat. Diastolic blood pressure. Both are measured in units called millimeters of mercury. Relying on precise blood pressure reading is important. Ambulatory blood pressure monitoring is currently regarded as the gold standard technique for clinical decision making and is a better predictor of outcomes than office and home blood pressure monitoring. Ambulatory blood pressure monitoring is currently regarded as the gold standard technique for clinical decision making and is a better predictor of outcomes than office and home blood pressure monitoring. Non-pharmacological management. Education regarding the importance of reducing salt intake to less than 5 grams daily, eating more fruits and vegetables, being physically active on a regular basis, avoiding use of tobacco, reducing alcohol consumption, limiting the intake of foods high in saturated fats, reducing trans fat in diet, reducing and managing mental stress, regularly checking blood pressure, managing other medical conditions. These are the non-pharmacological management guidelines for the patients. Pharmacological management of hypertension. Pharmacological management of hypertension consists of angiotensin converting enzyme inhibitor ACEI, angiotensin receptor blocker ARBs, diuretics urinary thiazides, calcium channel blockers CCBs, and beta blockers BBS, which are instituted taking into account age, race, and comorbidities such as presence of renal dysfunction, left ventricular dysfunction, heart failure, and cardiovascular diseases. Complications. There is a clear link between high blood pressure and an increased risk of heart diseases, in particular having a heart attack or stroke. Complications also include coronary artery diseases, hypertensive encephalopathy, renal failure, acute versus chronic peripheral arterial disease, atrial fibrillation, aortic aneurysm, and death, usually due to the coronary heart disease, vascular disease, or stroke related. Resistance hypertension, defined as uncontrolled blood pressure despite the use of more than or equal to 3 antihypertensive agents of different classes, including a diuretic, a long-acting calcium channel blocker, and a blocker of the renin-angiotensin system at maximal or maximally tolerated doses. Antihypertensive medications, non-adherence, and the white coat effect must be excluded to make the diagnosis. Resistant hypertension is a high-risk phenotype leading to increased all-cause mortality and cardiovascular diseases outcome. Healthy lifestyle habits are associated with reduced cardiovascular risk in patients with resistant hypertension. Aldosterone excess is common in patients with resistant hypertension, and addition of spironolactone or amyloid to the standard 3 drug antihypertensive regimes ineffective at getting to the reduction of hypertension. Refractory hypertension, defined as uncontrolled blood pressure despite use of more than or equal to 5 antihypertensive agents of different classes, included a long-acting thiazide-like diuretic and an mineralocorticoid antagonist at maximal or maxillary tolerant doses. Fluid retention, medicated largely by aldosterone excess, is the predominant mechanism underlying refractory hypertension. While patients with refractory hypertension typically exhibit increased sympathetic nervous system activity, that is refractory hypertension. Patient education recommendation. Physical therapists should contribute to education patients to monitor and manage their blood pressure as early as childhood before it becomes a serious health problem. The incidence of pediatric hypertension is increasing as a result of the obesity epidemic. Diet and exercise implemented at a young age are crucial in the prevention of hypertension. When medications are implicated, adherence is crucial in long-term management. It has been shown that approximately 50% of the patients don't take medications as prescribed by the doctor. According to the WHO, lack of adherence is the most important cause of failure to achieve blood pressure control. While medication adherence is important, physical activity should be equally emphasized, especially because it's a primary prevention technique. Aerobic exercise is universally implemented for hypertensive treatment because it lowers blood pressure 5 to 7 mm of mercury among adults. 30 minutes or more per day of moderate intensity exercise combined with resistance exercise 2 to 3 days per week is recommended for the patient of hypertension or high blood pressure. Thank you for your time.